You may be one of many people suffering from back pain, but afraid to undergo surgery because of the risks or long recovery time. If that's the case, you may want to look to Adena Health System in Chillicothe, where doctors are performing a cutting-edge spine procedure. Joining me from Adena is Dr. Jeffrey Lobel, one of only a few spine surgeons in Ohio to offer this new procedure. Dr. Lobel, welcome. Nice to have you here.
Thank you very much.
And this is exciting because there are people with back pain who are afraid of any type of surgery. They're going to be worse off than before. So how is this procedure different?
This procedure allows people to undergo surgery without having large incisions. It increases the rate at which they can get back to usual activities, and it also reduces the amount of recovery that somebody may require. So it opens the door to allow more people to have back surgery who may not have been candidates in the past.
So what kind of back conditions would this be good for?
The most notable condition is spinal stenosis, and that's a situation where if you think of a garden hose and somebody stepping on the garden hose where the water doesn't quite get through, if you're watering your plants, for instance, it allows me to open up and lift that foot up off the garden hose so I can put a special implant into somebody's back through a tiny incision. And that allows the signals that need to go down to your feet, which sometimes gets delayed, causing aches and pains, to return back to normal, frequently after you've recovered from the surgery.
So if you don't open up the back, how does this work? Do you go in I would think the word is minimally invasive?
Yeah, minimally invasive is sort of the new catchphrase for spine surgery. But this is indeed a minimally invasive surgery. If you think of a lot of people who've had surgery in the past and you look at their back and you see a sizable incision, this incision doesn't even go through your back. It actually comes through your side, in the underside of where your ribs are and just above your hips. So I'm able to avoid opening up musculature that you standardly think of when you have back surgery. So it's a very tiny incision. It does carry with it different types of risks, but overall, when it goes smoothly, people are very happy because they can get up and they don't have the same back type pain post-surgically when compared to individuals who have standard surgery.
What's this procedure called, or what kind of equipment do you have to use in order to do this thing?
The name of it's an extreme lateral lumbar interbody fusion.
Well, yeah, I asked.
Yeah, it's traditionally referred to as an XLIF, XLIF. So if you're looking it up and you're trying to learn about the back surgery, which I think is very important, that frequently people don't learn and understand what their procedures involve, you should look up something called an XLIF. It requires and uses special equipment where you operate through a small tube that's inserted through your side, and it allows me to access your spine through the side instead of through the back traditionally. So it is a very neat procedure from that standpoint, but if you're in the operating room or you're trying to really observe it, it's hard to watch because it works through such a tiny tube.
So recovery time is shorter?
Frequently it is a lot shorter for people, but again, it depends on the conditions they have and what their initial problems are before they come into the operating room.
Because that makes a difference. Someone may be watching this thinking, I'm a candidate, but then they come to see you, and if they have other factors that might not work for everyone.
That's very true. Spine surgery in general may not be best for everybody. There are a lot of conditions that I can't fix, and I frequently tell people I look for a recovery between 50 and 70% of what they came to me as in terms of a full recovery. But the expectations of spine surgery have to be reasonable when somebody comes in for back surgery, whether it's this procedure or any other type of procedure.
How long have you been doing this at Adena?
We've been doing this procedure for about 1.5 years at Adena. The procedure, again, is not the newest of procedures in terms of was it just developed last week or last month. It's been around for a couple of years and it's been tested, and the people continue developing better and better techniques with doing it. But overall, we've been doing it for about 1.5 years.
Well, I'm sure we have some viewers out there who are very interested in this and they want some more information. So we want to let folks know that they can contact Adena, and they contact the folks, and there's the phone number on our screen, and that's the Adena Health System in Chillicothe, and you'll be contacting the Bone and Joint Center at this number so that they can find out about the XLIF procedure. Dr. Lobel, thank you so much for being here.
Thank you so much.
Pleasure. I learned a lot.